go ahead and open again. So again, you could measure everything here. About 32, probably because you've been opening and stretching a little bit.
Oh, yeah.
So then to test overpressure, go ahead and open again. I'm going to have my fingers on your bottom teeth. So I'm kind of hooking her jaw, so I have like this position. And I might have just a hand on her head, and I'm just providing a glide down and kind of in, if you think of that rotation. And I'm just feeling, I'm not trying to jam it, I'm just feeling, is there something that elicits you kind of having pain, or do I feel a lot of tension, anything like that? So it should feel kind of like a soft muscle end feel. You should feel that tissue stretch there. And then same thing, go ahead and just kind of relax open. Yeah. And then go to the left. And so then same grip. And then I'm gonna kind of block on the other side, and I'm just feeling, can I go further? Any pain there?
No.
And then go ahead and open again, and then relax just a little bit. So I'm just looking for, I don't want her to be kind of past that rotational piece. So relax just even a little more. And then same thing going to the left. And any pain there?
No.
So the biggest thing is you kind of have to like remove your hand before you want them to answer.
Oh,
You get so used to like, oh, how are you feeling? And they're like, your hands in my mouth. Like, I don't know. So you're looking at, does it pressure stretch on the opposite side? Do they feel like a jamming on the same side? That's going to indicate more of that disc. So I'm not measuring that as much. I'm just feeling more of the end feel. And so I do passive and overpressure kind of together. Well, and then for protrusion, retrusion, you can test this in sitting. Again, your suboccipital tone and like where your head's positioned in sitting is going to change it a little bit more. So I like to do it at supine. And so I'm going to have you think about jutting your chin up to the ceiling. I'm going to just move your lower lip a little bit. So this one, I always feel like I'm guessing a little bit. So you want to line up with the bottom teeth and then back. You can't get super close. And she's about half or so, 5 millimeters. And which is good. This one I'm looking more like, is there pain? This will indicate more of like a pterygoid spasm because it pulls it back and doesn't let that kind of lower the mandible drop down and glide. And then kind of bring it back. So I don't care so much, like this one it's hard to measure too. And then I'm just gonna lower your lip. So I'm just looking like, yep, there's a gap, and I can get kind of a general concept. So there's about 2 millimeters there. So you're looking both at kind of where she rests from. So if she's already sitting, like when you look, if she's forward, I'm going to note that. And we talked about that a little bit too with one of the other groups Jessica brought up, so that if they're sitting and you look for lateral protrusion, if you notice, oh, they're already sitting a little bit to the right, you're going to document that. And then technically their motion to the other side is going to add that amount back in because they're going off center. So I'm looking how much their full jaw glides, but I also want to know where they rest at. If they're sitting more protruded to the left, to the right, are usually going to be what you see. So then you guys can go ahead and try those.